Blog Talk Radio.
Welcome. You're listening to Perfectly Healthy and Tone Radio with your host, Darren Fatman McDuck. And now, prepare to get fat. Hey, what's cracking? And welcome back to another episode of Perfectly Healthy and Tone Radio, brought to you by I'mTheFatMan.com. Good show tonight. We're going to be talking about holistic dentistry with Dr. Lorie Miller Stevens. There's a lot of things out there that I want to know about my teeth, and I'm going to be able to ask Dr. Stevens about that. If you're interested in asking her any questions, please call into the switchboard. The number is 646-716-9371. Again, the number is 646-716-9371. As always, join me on Facebook. I'm on Facebook at facebook.com/The Fat Man Radio Show. You can find me there and join me there, and you can get the latest updates on the show and what's coming up on the show. Other thing is join me on Twitter. I don't know if Twitter's old hat now. Maybe it is, but you can still join me on Twitter. My Twitter handle is TheFat_Man. So TheFat_Man, and fat is spelled P-H-A-T, which stands for Perfectly Healthy in Tone. So you can join me there. I'm actually on Pinterest as well. Don't use Pinterest as much, but you can find me on Pinterest, and you can join me on those social media things and find out what's going on with me and find out the latest updates on the show. Last week we had Dr. Bruce Fife on the show talking about the coconut oil miracle. So if you want to know all there is to know about coconut oil, you can check that show out in the archives, or you can download the show on iTunes. All the shows are in iTunes, and you can download them and listen to them in your car, which is what I like to do with other different podcasts, and or listening to them while I'm in the gym or sitting in the sauna at the gym, or whatever you like to do when you chill out. So you can definitely take those shows with you and learn on the go. So tonight we are talking about holistic dentistry. A lot of times the mouth, they say the eyes are the window to the soul. I guess the mouth is the window to the body. So you can actually tell a lot about a person's health by looking into their mouth. And Dr. Lorie Miller Stevens is going to actually tell us a whole lot more about that. So let me bring Dr. Stevens on the show. Let me see if I can see her in the switchboard. Dr. Stevens, are you there?
I am. Hello. How are you, Darren?
I am doing awesome. Welcome to Perfectly Healthy and Tone Radio. How are you tonight?
Doing fine, thanks. Glad to be here.
I am so glad you are here. I have a ton of questions to ask you as we were talking them off the air. I'm saving them for being on the air, but I have some questions for you, and we'll get to those. But first of all, when I have a guest on, I just usually like to ask them how they got started. And my $1 million question for you is, what made you get started in holistic dentistry when you could have gone in to what I would call conventional dentistry?
Well, that's a good question. And I actually practiced in conventional dentistry for about 25 years and began to get sick. And as I tried to find out what was wrong with me and why was I getting sick, my search and research led me to Mercury Toxicity, which I have been around for now almost 35 years. Mm-hmm. And as a dental assistant, we used to mix liquid mercury with powdered metal to create the amalgam that would go into the mouth. And even with a cheesecloth, we would squeeze out the extra mercury. And, of course, the dental offices back then had shag carpet. And most people know that it's the mercury vapor that is so toxic. So if any little bit of mercury we spilled sat in that shag carpet, and we sat over it and breathed it all day. And so the research shows that dentists are really sick people. As a group, we take more respiratory, more cardiovascular, more neurologic, and more neuropsychologic drugs than any other group of people. So that may explain why we act like the Mad Hatters. So that's how I got started in holistic dentistry and trying to protect myself and my patients and my staff from the number one toxic material in dentistry, of course, is the mercury. And I'll go ahead and just start talking about the fillings, if that's okay. The mercury amalgam fillings.
Yeah, that'd be great. Let's get into that. And actually, while you're tackling that, are those outlawed now, or are dentists still using those?
No, they're not outlawed. As a matter of fact, the Minamata Convention in Japan was held late last year, which was a worldwide meeting to try to get all countries, all nations, to phase out the use of mercury. Dentistry is still the second largest user of mercury, and there are still dentists putting mercury amalgam fillings in. Now, this is a controversial subject for a lot of people, very emotional issue, and even to call fillings mercury fillings, if the Federal Trade Commission were making a ruling on this, because the filling material is more than 50% mercury, in food, the Food and Drug Administration makes you call, if your cheese puffs are not made of cheese, they make you call them cheesy puffs if they're not real cheese. But, you can't use the word cheese if that's not a primary ingredient. So Federal Trade Commission kind of does the same thing in other circumstances, not in amalgam. Amalgam or silver fillings is the word most people are familiar with, but the mixture, the content of the filling material is actually 50 to 54% mercury. So being the primary ingredient, to be technical, they really should be called mercury fillings. But we're not, and the ADA has not allowed that through the years. But I think people are realizing the makeup of that material is really more than 50% mercury. So, that was not a focus of what we learned in dental school. That was not a focus of dental meetings I went to for years and years. And I think that there are so many toxins in our environment now that our susceptibility to toxins is much lowered. And so we have a lot of folks now, if you look at the people that are becoming sick earlier and earlier, look how young people are getting cancer, look how many people are getting Parkinson's or Lou Gehrig's disease or MS. All of these severely debilitating diseases are really a reaction to your level of toxins. And toxins are not 1 + 1 = 2. Toxins are 1 times 1 or 1 + 1 = 100 times more toxicity. So 2 toxins together is 100 times more toxic than 1 toxin plus another. So it's not 1 + 1 = 2. It's an exponential increase in the amount of destruction to the body, or the amount of toxicity to the body. So one of the most important things that people should know about silver, amalgam, mercury fillings, whatever you want to call them, when they are taken out, it's a very, very, what's the word I'm trying to say? You have to be very careful taking them out, because when people say, I want to get these mercury fillings out, if you just go drill them out the way I did for years before I knew there was a particular protocol to protect myself, the staff, and the patient, then you're exposed to a lot of mercury vapor when you're drilling those old fillings out. When they're already hard, you have to cut them out. So there's a particular protocol that you should go by. And mention the Vanguard group of science and research regarding mercury. We just had our 30th anniversary. The group is called the International Academy of Oral Medicine and Toxicology. In short, the IAOMT.org is their website. They're the Vanguard group that started 30 years ago, started funding research to actually show the science. There were a lot of people. Hal Huggins was one of the first most vocal dentists who spoke out in the last 30 or 40 years about mercury and its toxicity. That argument's been going on for 150 years, because amalgam fillings have been around for that long, or just about that long. So the argument has been going on for that long. But recently, in recent years, Hal Huggins kind of started that movement again, and there are a lot of other folks who have championed this quest to show the science and let people know that having amalgam fillings in your mouth, you are exposed continuously to mercury vapor. I was taught in school that the mercury, once it was mixed with the powder amalgam, the powder metal, that the mercury became inert and it did not come out. Well, the IAOMT research plainly shows that the vapor does come out. And even, there's lots of research, not just from that group, but there's lots of research that says if you have those fillings in your mouth, you are being exposed to mercury vapor. And you can go to the IAOMT.org website. They have a great library. We just opened this to the public. We just got it all online and all digitized. And there are over 900 research articles they're free for people to look at, to read. There are videos of actual, one video is a 25-year-old filling in a tooth that has been extracted for almost that long, and the mercury is still coming out. They show the mercury vapor in front of a fluorescent screen, and it shows the mercury vapor particularly when the tooth is scratched, which mimics the chewing motion, or when it's heated, they rub it with a pencil eraser to just increase the temperature, and the smoke comes off more, and that's the mercury vapor that is visible to the eye because of the fluorescent screen behind it. And so the IOMT does lots of research, teaching, spreading the word. There were representatives at the Minamata Convention in Japan to try to phase out and particularly phase out the use of mercury in dentistry, because we're the second largest contributor of mercury, or user of mercury, in the world. It's 340 tons a year. And that's, mercury is the most toxic element other than the radioactive elements. And so it is toxic, and we need to stop. And in Georgia, in many states actually, but Georgia, we don't have to have mercury separators in our dental offices, so we can drill out the old amalgam fillings, creating the mercury vapor in the office, and then of course the water and the particulate matter that is removed from the mouth can go right out into the sewer and right back into potable water. So dentistry is the largest contributor of mercury into our drinking water system. And so some states have mandatory mercury separators. I have one, of course, in my office, but it's not mandatory in my state. So we're working very closely with the EPA to try to get the EPA to regulate that, because the ADA has suggested that people have them, but it's not mandatory at all. And so we want to help patients not be contaminated through their mouth or through their drinking water. And there are other uses for mercury too, but a really strong phase out in the use of mercury in medicine, particularly. You don't get mercury thermometers anymore, that kind of thing. So the use of mercury is going down in many ways. Unfortunately, light bulbs, it seems to be going up in the use of light bulbs. So fluorescent light bulbs do use mercury. So we need to be aware of that too, and have people show their displeasure at these new fluorescent light bulbs, because incandescent light bulbs are going by the wayside, and they're much safer as far as I'm concerned. They do use more electricity, and of course coal burning power plants do create some mercury into the atmosphere too. So in the long run, I think if we can use less electricity with the coal and less electricity from the light bulbs without using mercury in the light bulbs, that'd be the best thing there. I didn't mean to digress into light bulbs there, Darren,
okay.
So help me get back on track. And
okay, that's okay. Actually, I was going to ask you, because you mentioned a specific protocol to take the mercury fillings out, and I remember when I did mine about 4 years ago, maybe longer than that, maybe 5 or 6 years ago, and I thought that I was doing everything so right, but I remembered that The dentist didn't do anything, and I'm here in Florida. The dentist didn't do anything other than just drill them out. So I know I have mercury toxicity, and I still have one that he told me that he couldn't take out because something would have happened to the tooth. But I'm just wondering how involved is that process?
Well,
when
it's not really right. It's not really that involved when you get somebody who is familiar with and I'm on that board of directors for that organization, and I'm in the midst of writing some presentation materials to just share with people what is involved in the protocol. On my website, I have a little video that explains it for my patients, but in general, there is no quote-unquote the protocol. There is a large number of dentists now who are using some forms of accepted methods or measures for quote-unquote the protocol. But basically what should happen is the patient should be draped, the dental staff should be draped. We know that the mercury vapor is absorbed 80%. Whatever 80% of what goes into the lungs is absorbed into the body and quickly crosses the blood-brain barrier. Mercury has an affinity for tissues like brain tissue, liver, lungs, stomach, and so we know it quickly finds its way into hiding places in your body. So 80% of the vapor is absorbed, and so alternate air source for the patient and the staff. They need to be breathing something other than the ambient air. A large volume suction. People may see either on the IAOMT, there are pictures on their website, there are pictures on my website. Mine is gaholisticdentist.com, and I've got some pictures and a little video there. But you need a large volume suction that's outside the mouth. Looks like a kind of a big elephant nose suction that is there in front of the patient's face to just create a vacuum to suck that air that is coming out of the mouth where you chunk the amalgam in pieces, and that may not mean anything to a non-dentist, but you don't want to grind it into powder. You want to chunk it in pieces. And the way we used to have to cut the hole to put the amalgam fillings in, they're wider at the bottom than they are at the top. So you have to cut that so that those pieces will come out. It's kind of like sticking your hand in a mayonnaise jar and then ball up your fist. It won't really come out. So we have to cut them in a way that they come out in big chunks because that is less particulate matter. There's new studies out now with some of the IAOMT members doing research even in their own office with mercury vapor analyzers. And Dr. Oz had one on not too long ago, 6 months or so ago, and he showed the mercury vapor being measured as they just brushed an amalgam filling or whatever. Well, those mercury analyzers show us that the particulate matter, the little pieces or the powder of that amalgam, mostly hits the dentist in the face and gets the assistant's leg. If it's not suctioned with high volume suction inside the mouth and outside the mouth. So another thing that most people are aware of is called a dental dam, and that is a cover that goes over the patient's mouth, and it just has that tooth or whichever teeth are being worked on exposed, so that keeps vapor and particulate matter from going down the patient's mouth and throat. And so a lot of people will use an activated charcoal slurry or a charcoal powder to have the patient either swish and swallow before they start the procedure, or I like to use a charcoal powder dusted around that area inside the mouth under the dental dam. And we know that rubber gloves and rubber dental dam are not as effective at protecting the patient and the staff as are nitrile. And so many people are allergic to latex rubber gloves anymore. This day and age, I don't use any rubber in my office, but the nitrile's better. So you're draping the patient. You've got a big suction inside, big suction outside. You've rinsed and dusted with some activated charcoal. You've got that dental dam on. And in my office, there are different kinds of alternate air sources for the dental staff to use, but I use a full face mask that is basically like a gas mask, sort of, not like you've seen, in the old Army movies, but it basically has canisters that filter the air that I'm breathing. Then we have an alternate air source for the patient underneath the cover, the dental dam that goes over the mouth. They have a mask over their nose to protect them, and you don't have to do any particular, like it doesn't have to be oxygen. It can be like air from a scuba tank that's just regular breathing air. We just don't want the patient breathing the air that we're trying to have go up that big suction while we're taking the amalgam out. And the patients should be covered. I mean, their hair should be covered, their face should be covered, their clothes should be covered. They should be covered because the plume or the cloud that comes out when you use a dental handpiece, the water's there to cool everything, but it creates a cloud of that dust and water. And so we will use a large volume suction inside the mouth on top of the dental dam, and then we also use that big one outside. So we're really creating a vacuum to suction and filter that plume as we drill on the tooth. We want to suction and clean and filter that plume as quickly as we can. Now, the patients should be in good health as far as kidney and liver function, because no system is perfect, and the silver filling or amalgam mercury filling is in contact with the tooth, and teeth have 3 to 9 miles of tubules or water pipes in them. Back teeth have usually about 6 to 9 miles of little water pipes in them. That's usually where the amalgam fillings are, is in the back teeth. So that amalgam is already in contact with the tooth. So there's going to be some of that. Although small, there's going to be some amount of that is drawn into those tubules. So the body's going to have to be able to excrete some of that mercury. There's going to be some contamination, even with barriers, if you use all the barriers. And they're different. I didn't mention that there are some differences from office to office as to what barriers to be used. There's different kinds of suctions. One's called a cleanup. Some dentists will use different combinations or different types of masks or alternate air source, different types of drapes. And there are people, I'll go ahead and mention this, there are people that we say, quote unquote, are allergic to mercury. That's kind of just a general layman's term. There are different genetic mutations that some people are more sensitive or they are more harmed more easily from mercury. And when a dentist is that sensitive, then he has to take extra precautions. And if the patient is that sensitive, then there have to be extra precautions. And those are DNA tests to see if they have that genetic mutation that makes you more susceptible. So you'll see some pictures on the IOMT website. You'll see some pictures of dentists and staff in Tyvek hazmat type suits. They've got the hood and everything on. Not everybody wears that. Some wear a surgical gown. So there are differences in the protocols, but those are the high points. Masks, coverage, some kind of dental dam, some kind of suctions, an ion generator that generates negative ions that's going to help to make that mercury, whatever vaporized mercury, make it less liable to react with you. And the air filters too. We've got HEPA filters and mercury filters and lots of stuff to help keep everybody safe. And then, of course, the waste removal is really important too, of what, we want to be sure that doesn't go in the sewer. That mercury sludge that was, once the mercury is drilled out of the mouth, you want to be sure it's not going in your drinking water.
Yeah. Dr. Stevens, real quick. I see 2 people that are in the switchboard. If you have a question for Dr. Stevens, just hit 1, and I'll know that you have a question, and I can bring you on the air. Again, the number is 646. Is anyone out there listening? We're halfway through the show. The number is 646-716-9371 to call in and get your question answered by Dr. Stevens. And those of you who are already in the switchboard who have a question, just hit 1, and I will see that you have a question, and I will bring you on. It sounds like it's real serious, this mercury stuff. I wanted to jump into another area of controversy, so to speak, and that is fluoride. I've heard a lot of different things on fluoride. What's your stance on that?
Well, fluoride is the most reactive element there is. Fluoride wants to jump on something else and react with something else more than any other element. And fluoride is basically toxic, very toxic. The research that was done back in the 40s that said fluoride helped teeth, helped reduce decay and that kind of thing, was done by the same by the same research company that did the asbestos research. So that might tell you something. It was also funded by large industry, chemical industry here in the United States. So if you look over the last 50 or 60 years, there is not a correlation between fluoridated water and less decay. There are areas that have never been fluoridated that actually have less decay than areas that were fluoridated. It's a very controversial topic, and if you really find out where the fluoride in municipal water systems comes from, 91% of those municipal water systems, the fluoride is not sodium fluoride pharmaceutical grade. It is actually toxic waste from the petrochemical fertilizer industry, and their air scrubbers that catch that smoke or smog coming out of their smokestacks. The EPA won't allow them to let that go out into the atmosphere, so they have those scrubbers. That's where 91% of the fluoride that goes in municipal water systems comes from. It's industry, chemical industry waste, and that's shocking to most people. But there is no evidence that fluoride reduces decay, and there is lots of evidence, studies that have been done in China and then reproduced again in the United States, that shows fluoride is detrimental to IQ. It's detrimental to the teeth and the formation of normal, healthy enamel. One of the things that it helps to do is calcify the pineal gland, which is an emotional type center that helps with the hormones and the emotions. It also causes early puberty. If you look at kids these days, puberty is happening earlier and earlier and earlier. And then many of us remember that that in the concentration camps in Germany, the prisoners were given fluoride to make them lethargic and make them apathetic. So fluoride is not good, and I would have everybody avoid it in all circumstances.
I'm gonna blow your mind right now. Have you ever read the book, The Plutonium Files?
I have not.
Pick that book up. That book, it talks about the gentleman, I believe his name is Hal Hodges, the gentleman that was linked to inventing the bomb, the atomic bomb?
The hydrogen bomb.
It goes through that whole thing of how all of these people were affiliated and how they were the ones that kind of recommended that we started putting fluoride in our water. But it's a really, really good book. So not a long book, but really, really good book.
Fluoride is, they need a place to get rid of the waste. And if you look at the quote-unquote natural high fluoride levels in the western United States, look at how many bombs were tested there. And it is a byproduct of testing bombs. Just like, as a side note, in North Georgia, where I live, there is naturally, quote-unquote, naturally a high level of arsenic in the water table. Well, that's from the poultry industry because they put arsenic in the chicken feed to keep the bugs out. And so that natural high fluoride level in the western United States, I think, can be traced to the testing of the bombs. You're absolutely right.
Yeah. Yeah, if anybody's out there and you're listening, that book is called The Plutonium Files. It's a 400-page book, but it's well worth the read, and it kind of puts everything together. Really, really well-researched book as well, and I think that they talked about that. President Clinton, when he was in office, actually apologized for that whole fiasco and what went on, but nobody really paid any attention to it. But pick that book up.
That's right.
Yeah. Another thing that someone wanted me to ask you about was just oil pulling. How do you feel about oil pulling? That's become a rage now, and everybody's into that. But are there any advantages to that?
I think that oil pulling is, from what I see in myself and my patients, I think it's very beneficial. Oil pulling, I think the history is started in Ayurvedic medicine, and they used to use safflower oil or sunflower oil, some of the other oils, but the one that's most popular now is coconut oil. And I think coconut oil is a super natural ingredient that we have that's very very beneficial. I won't go into it since you just had that last week. I won't talk a lot about it. The one thing that I would like to see is some research on what the oil does to dental cements. And that's my only reservation, is that some of the older cements may be the old cements, and I say old, I've been in dentistry for 35 years, so the cements that I started using back in the early 80s are not really used much anymore, and those are the cements that I worry about the oil may have some detriment to. So that's my only reservation, but I haven't seen any research on it yet. That's just a personal reservation that I have. But I do know that coconut oil is very beneficial, and just briefly, the Alzheimer's groups suggest 5 to 9 tablespoons a day to be ingested if you have Alzheimer's in your family. Also, the ADD, ADHD groups say 3 to 5 tablespoons a day for anybody with ADD or ADHD. And so I know that coconut oil is a combination of capric, caprylic, and lauric acids, and they are antiviral, antifungal, antiprotozoan, and antibacterial. My take, just as a quick, how does it work? What does it do? I think it lowers the body burden of microbes in the mouth, and when you swish and hold that, it kills those bugs in the mouth. And then, bugs in the body, they have a predilection for where they like to live, and yet they travel throughout the body. We are more microbes than we are our own cells, and so when that ratio of good bugs to bad bugs gets switched, and we have more bad bugs than we have good bugs, I think that oil pulling really does help to replace that balance between good bugs and bad bugs. Now, and so I see a lot of benefit, and I see patients begin to have better health. And I think that's one of the things that when people are trying to get into a healthy lifestyle, going gluten-free, and of course, getting rid of artificial sweeteners and chemicals and dyes and food additives. That's one of the things they start doing is oil pulling. I think it's great.
Good. Again, if you're in the switchboard and you're bashful, you have a little bit of time to ask your question. If you want to get on, you are just hit 1 on the switchboard, and I will see that you have a question and bring you on. Otherwise, we're going to roll on with the show. Let's talk about the health of someone's mouth. I know that you've seen many, many mouths in your practice. Mm-hmm. What can you tell about someone's health from their mouth?
Oh, gosh. The first thing probably is, and everybody can tell this. Sometimes you talk to somebody and even 2 or 3 feet away, you get this horrible odor from their mouth, and that's the sulfur compounds from people who have gum disease. And so gum disease is one of the very first things that you can tell by looking in somebody's mouth. And gum disease is an autoimmune disease, so you basically become allergic to your own tissues, and that happens so many times now. So many of us have autoimmune issues, and one example is that the plaque collects around the teeth, and the plaque is, of course, just bacteria. It's just 90% microbes, and as that as that plaque accumulates, the plaque begins to change its composition of good bugs and bad bugs. And as the plaque gets older, it gets more and more of the bad bugs that are anaerobic. They don't like oxygen. That plaque and tartar start to form down under the gum where there's no oxygen. And that's when it really gets detrimental, when those bad bugs move into those places that oxygen can't get to. And when that happens, then the body recognizes that basically those bacteria eat and breathe and poop like we do, and their waste products are acid and they are toxic, and our body begins to recognize those toxins and try to fight those toxins. Well, an autoimmune issue occurs when your body gets a little bit confused and it can't tell what's the toxin and what's the bacteria and what's your bone or your gum or your connective tissue. And the body then starts to destroy your own tissue, thinking that it is those toxins, because it is always intimately involved with those tissues in the mouth. Then the body actually starts to destroy itself. And that's basically, that can happen with your thyroid with Hashimoto's. You know, most people have had some kind of virus or something before they develop Hashimoto's. And that's how autoimmune issues happen, is the body's trying to protect itself, and it actually starts to destroy itself. So gum disease is one of the first things we can see. One of the things that I've been studying for the last year and a half or so is tongue diagnosis, and I see lots and lots and lots of patients with big, fat, thick tongues. That's a sign of digestive issues. If you have scallops on your tongues, if you have when you stick your tongue out, you have kind of teeth marks on your tongue, that means your tongue is swollen. That's a sign of thyroid issues, digestive issues. A lot of people have a coating on their tongue, a thick coating. That's digestive issues. It can be in Chinese medicine. They call that sometimes, and I'm not well versed in Chinese medicine, so a caller may call in and correct me. Feel free if the callers know more than I do about Chinese medicine, but they can sometimes call that too wet or too much of the water element for the tongue. You can look at a very, very interesting issue for me is grinding teeth, crowded teeth, extra thick bones in the mouth. Some people will have a little growth in the roof of their mouth. The bone gets a little thick there, or down by the lower front teeth, they get some extra bone growing there. That's from clenchers and grinders, people who clench and grind their teeth. Then the body tries to absorb that shock, and it makes the bone thicker. Well, I have, over the past years, been just noticing people who clench and grind have this added bone. Well, I also have put two and two together, and those people who clench and grind, it comes from an airway issue. And airway issues can come from too much mucus, and back to like the Chinese, they call too much water element, a wet spleen, or too much mucus in the body makes it hard to breathe at night and during the day. And too much stress also causes us to shallow breathe, and our breath patterns get skewed, and we don't breathe deeply like we ought to. And that skews our carbon dioxide oxygen ratio, which has a whole effect on the growth of the mouth. It relates to, causes crowding of the teeth. Also, if the carbon dioxide ratios are not right because of shallow breathing, it can actually cause sleep apnea and snoring and things like that. It's not just a obstruction because somebody's overweight and their soft palate makes them snore or obstructs their airway. It has to do with how we breathe during the day and how much stress we're under. And also leaky gut. Leaky gut comes from, I think, toxins in the body that allow the gut to leak undigested proteins into the bloodstream, which is a large part of that connection of the autoimmune issues we see so much these days. But I'm excited. I do the webinars for the Holistic Dental Association. I'm excited to have a webinar tomorrow night on Buteyko breathing. I think I'm saying that right. So I'm interested to learn more about that and how our shallow breathing during the day because of stress affects our breathing at night, and that carbon dioxide ratio actually helps to start the diabetes process. It helps to start the high blood pressure process. Has an ill effect on many of our body functions if we don't get the right carbon dioxide oxygen ratio. And so just to start belly breathing, to make your belly come out, to really get a good breath, if people will start practicing that, we stay so stressed. And dentists and dental staff members particularly, we hold our breath a lot because we're so close to people. And
I would imagine
I've been in dentistry. Yeah, I've been in dentistry for a long time before we started wearing gloves and masks and all that. And so you just kind of didn't breathe over somebody. And so that may be part of the reason that dentists are so sick, because we take, I mentioned all those medicines earlier that we take more so than any other group of people. And so I'm really excited just to learn how to breathe. That sounds crazy, but I just want to learn how to breathe right again. And so deep breathing with exercise and breathing through your nose is really important.
Mm-hmm.
One
little
trick I think I mentioned one little trick to you earlier, Darren. If people want to relax, if you close the left nostril and breathe for a minute, half a minute, something like that, 10 or 20 good breaths out through your right nostril, that'll help you relax. Or if you get a little drowsy or sleepy and you want to be alert, close the right nostril and breathe through that for a while. So that's one of the tricks I've learned from the breathing classes that we're taking. And so that's one of my goals, is to teach other dentists these things that will help patients. And so I'm excited about that. I'll have to come back and we'll talk about the breathing thing after I learn more about it.
Yeah, we got a lot of questions we didn't actually get to. I wanted to give you go through about 3 real quick questions to answer, and then I wanted to get the root canals before I let you go, because I'm very interested in that.
Absolutely.
The first one would be, and people will probably kill me if I don't answer these 3 ones, and you can answer them real quick. Best toothpaste, best natural toothpaste for someone out there.
I do not have an answer for that. There are so many different parameters that people want. They want to have a certain feel or a certain taste. And I'll just tell you, I think people can make their own. I think a coconut oil base is really good. I want people to be careful by putting baking soda. You don't want to brush baking soda down if you have receded gums. The roots are real soft. But bentonite clay and a coconut oil base, maybe with some essential oils, whatever flavor you like to flavor it, I think are really good. Anything with a calcium phosphate. And there are some, you just have to look and read the ingredients. Calcium phosphate is actually what remineralizes the teeth, and that's the ingredient that will help you if you need some help to remineralize the teeth from the outside. And so I don't have an answer for a brand name. Okay. I am working on making some of my own natural products, though, so when I get one made, I'll let you know.
Let me know. I'll be the first one to buy it. Toothbrush. I use a Sonicare.
Mm-hmm.
That was recommended to me years and years ago, and I kind of swear by that.
Just hold it still. Yeah, just hold it still.
Yeah, that's my only problem. Sometimes I catch myself. I actually did it this morning. I was brushing my teeth, and I caught myself using it like a manual toothbrush, and I'm like, remember to hold this thing still.
That's right. Hold it still. And I teach people to use just a little cheap disposable toothbrush. I give just cheap disposable toothbrushes, and I give everybody a dozen of them when they come. I want you to stick one on your desk. I want one to stick it in your car. So I like people to dry brush during the day. And so my thing is, if you get the bristles under the gum line, you can't move the toothbrush very much, or you'll pull the bristles out from under the gum line. So if you just start in one area, start on one tooth. And I have people usually start on the lower right inside. That's most where everybody bleeds, inside lower right, whether they're right-handed or left-handed, doesn't matter, because the right side of the body is the positive pole. The negative bacteria are attracted to the right side. So that's why everybody bleeds more on the right. So I just have them stick the bristles under the gum. I don't care how you do it. I don't care how you hold it. I don't care about angles and all that. Just stick the bristles under the gum and jiggle. Try to make a manual toothbrush feel like an electric brush. Try to make it vibrate under the gums. And you just press, vibrate, lift, press, vibrate, lift, press, vibrate. You just want to clean under the gums, because that's where that bad stuff happens. That's where the bacteria that tolerate oxygen change into the neighborhood of, or the community of bugs that don't tolerate oxygen, the bad bugs move in under the gums. You want to clean under the gums and get some oxygen under there. And I'll just tell you, there's a great product called the HydroFloss that it's like a water pick, but it ionizes the water, and that will help clean under the gums down to 8 millimeters. That's deeper than you can get with anything else. And so there's scientific research that shows the HydroFloss will actually help failing teeth, gum disease, failing teeth, failing implants, help to heal those. And there's a discount code, and I hope I'm going to say it right. You can just go to hydrofloss.com and get like $30 off or something if you use 505890. That is, how did you hear about it? And that's just the discount code, 505890. That's the cheapest way to get one. But I have seen people turn their mouths around with a HydroFloss. Absolutely.
Yeah, I use
better
the
irrigator. Than flossing. Okay. Well, if it ionizes the water and puts those negative ions in there, the negative ions really do disinfect. And so that's the main thing. Find out if your irrigator puts negative ions in your mouth, because the HydroFloss does, I know for sure.
Oh, okay. I'll have to check that out. And I have one more question before we go to the root canals. Veneers. The whole veneer thing, are they safe?
Well, it depends. Now, 15 or so years ago, I had 10 front teeth cut down almost like a crown. You know how for a crown you have to cut all the enamel off the tooth? Well, I had 10 front teeth cut down like a 3/4 crown. So they cut all the enamel off the front and the end of my teeth on the front 15 years ago. Well, I would never do that to anybody now, because there's so many good products that you just put on top of the enamel. And it's kind of like a contact lens that goes on top of your eyeball. You know, the contacts now are so good. It's hard to tell sometimes when people are wearing contacts. And so, same thing with the veneers. There are so many materials now out there that are so strong in such a thin way, they just go like contact lenses on top of the teeth, and you don't grind the teeth down. So that's my only suggestion for people is don't get your teeth ground down for doing veneers for looks. And sometimes if you just want to bleach your teeth, there's lots of really quick, easy, just paint on bleaches now. We use a little pen, you just paint on for 3 minutes, and it turns to water, and you spit it out. You don't have to rinse or anything. You don't have to have trays or strips or any of that kind of thing. So if you're just looking to change your color, then there's a really, really simple paint on bleach now that's really not harmful. It's hydrogen peroxide that turns to water, and it's in a gel that doesn't drip all over, doesn't hurt your gums. And I've only seen in all these years, the bleaching started about 1980 or so. In all those years, I've only seen one person bleach too much, and I told him, "You got to quit." And he just was just neurotic about it. And so it's really hard to damage your teeth unless you just are doing it way too much, and your teeth will turn kind of light blue. Anyway, they go way past white to light blue, and you can tell you're doing it too much. Like you've seen the people who tan too much, and they look funny. So, yeah.
Yeah. So with that thing that you were mentioning, how long does that last if you do the paint?
The bleaching? Well, a bleaching pen's just an alternative to, if you want to change the shape and the, how big your teeth look or close spaces or, make them not look rotated or something, then Lumineers is one of the brand names that people hear a lot. I've done I've done a ton of Lumineers in my office. And so that's if you want to change the look of them. If you just want to do the bleaching pen, I use, I'm not even sure what the name of it is, to tell you the truth, but we'll give everybody my information. They can call the office. But it's a 3-minute gel. You can brush and floss in the morning, whatever. Like while I wash my face or something, I just put paint the bleach gel on my teeth, and then while I wash my face, when I'm done, I just spit and I'm done. No trays or anything. Now, if your teeth are like a white shirt, ketchup and mustard and chocolate and barbecue sauce will stain a white shirt. Your teeth will absorb stain through the years, particularly red wine and dark chocolate, which I love, things like that. So if you're gonna put the stains on your teeth, then you gotta bleach it off, because toothbrushing won't really get it off. So you just have to. Oh, yes, and coffee. That's right. You just want to have your coffee or whatever in the morning and then bleach. Don't bleach and then just drink your coffee, because you've opened the pores a little bit and you want them to seal back after you bleach. So it's better to have your coffee and then bleach. And then, of course, don't brush your teeth right after you bleach. If you use any kind of bleach, you don't want to brush the teeth that's too abrasive right after you've opened those pores. You can scratch your teeth. So for anybody that's bleaching in any way, don't brush right after the bleaching.
Yeah. Last question for you. Let's get into this thing about root canals. We got about 10 minutes. Yeah. Hopefully you can do it in less than in that time. I know. Yeah. You had a bit of a sore throat.
Yep.
I've heard.
How about if I just tell you my spiel? And my spiel is going to answer most everybody's questions. That okay?
Tell us your spiel. Go right ahead.
Okay. All right. So there are as many opinions about root canals as there are people. Now, Hal Huggins, and he's towards the really, really, really conservative group. Most people know his name. He lost his license for speaking out for what's safe for people, and he's done a lot of good for the toxicity in dentistry. So he'll tell you, don't have any root canals, don't have any implants, don't have any porcelain, don't have any composite. So we asked Dr. Huggins, I see him at our IOMT meetings, so I've seen him twice already this year, and we say, well, Dr. Huggins, what would you have us do? Take all those teeth out. So that's one opinion, way over to the conservative end, and then conventional dentists would say, there's nothing wrong with a root canal, have a root canal, if it doesn't hurt, there's nothing wrong with it. Well, my opinion is this, and I've kind of come full circle back and forth from root canals are okay to don't have any. There are some balancing acts now. Ozone therapy is a super balancer for people who are relatively very healthy, who have root canals, and you can maintain those in an energetically balanced state. And so for anybody who's familiar with energy medicine, or it's actually it's easy to test the voltage of teeth. And so ozone therapy can help you save root canal teeth if you are relatively healthy, the tooth is relatively healthy, and even though it's got root canal filling. And there is a holistic type filling material, and there is a conventional type filling material. Research shows that the conventional filling material, which is gutta percha, which is just a natural rubber substance that's sterile when the root canal is placed, does allow microbes to move back in and reinfect the tooth, thereby being a chronic infection in the body, which is very detrimental. Ozone is the thing that can balance that. So ozone can keep those bugs at bay and keep that real acid environment more neutral. Now, if you have autoimmune issues, if you have health issues, and you're not real healthy, then my suggestion is you need to weigh very seriously if you're going to keep any teeth that need to be treated with a root canal. And you treat a tooth with a root canal because the nerve is dead. That's why you treat one with a root canal. And there are people who say you don't need any dead tissue in your mouth. But some people will tell you if they have a denture or partial that is just hooked to 2 or 3 teeth, and they are robust, healthy people, and those root canals then are treated periodically with ozone, those teeth can test with a healthy voltage or a healthy energetic balance. So there are lots of teeth that are not healthy root canal teeth, and if they show on the x-ray a dark spot around the tip of the root, that just shows that's harboring infection, and there's not much more detrimental to you than harboring chronic infection in your mouth, in your teeth. Now, we spoke a little earlier about the root canal cancer connection. Does having a root canal cause cancer? No, not directly. But is it very detrimental to people to keep infected teeth in their mouth? Absolutely. For anybody who's familiar with the meridians in the body, the teeth are the circuit breakers. The meridians are the energy, electricity pathways. That's our wiring in our body. Our fascia, basically, is our electrical wiring. And a bad tooth will short-circuit that wiring and not let the brain talk to organs or organs talk to muscles, that kind of thing. My power flickered at my office today and everything went crazy. So if you have a short-circuited breaker that flips, then you short-circuit the communication in your body, and your cells can't talk to one another and your organs can't talk to one another. So the teeth are the circuit breakers in that system. Dr. Jerry Tennant has done extensive writing on this, and so a short-circuited tooth can allow for areas in the body to distant areas from the tooth to become infected because of a short-circuited tooth. So a bad root canal tooth is a really bad thing. I have noticed in my practice over the last 35 years that as people begin that downward spiral of chronic disease, their body begins to use, and this is just my opinion, my layman's explanation, the body begins to use the mouth as calcium phosphate bank account, savings account. We need calcium phosphate. That's the biggest mineral in our body. We need that to make our muscles work. The heart, of course, needs the calcium to beat. We know how important calcium is. And balancing blood pH. That's one of the most important things that the body can do is keep the blood at the right pH, very critical pH. So we use our extra stores of calcium phosphate. Our teeth are just specialized bone. They're the same makeup as bone, mostly calcium phosphate. So I think the body's savings account is our mouth, and when the body is in distress and it can't absorb the minerals that it needs because of leaky gut and poor digestion, and we've had antibiotics, and now our gut flora is out of balance, then I think we use the calcium phosphate out of our mouth to balance and buffer as a safety net. And in that chronic spiral of downward spiral of chronic disease, then people begin to notice they're having teeth abscess and they're getting more root canals. And I think that is a symptom of an overall chronic disease. Do I think that the teeth actually cause cancer? No, I don't. But I think they lead to a further downward spiral of ill health. I think they're a sign that things are really going south. And yes, are there microbes harbored in those teeth that have been found in cancers? Yes. I think the bacteria and virus and protozoan and fungus in our mouth travel all over the body. And I think the body is a source of distant infection. And there are European and now American studies done in North Carolina that say every breast cancer starts with a lesion in the mouth. So do the teeth actually cause cancer? Indirectly, maybe, but a chronic infection in your mouth is very detrimental to your immune system. And if your immune system is busy over here trying to work on these abscesses that have been there for years and years and years, your immune system can't go pay attention to other things and eat up cancer the way it's supposed to. We're designed to eat up cancer, to seek it out. Our body's supposed to seek it out and find it and eat it up. And if your immune system's busy doing something else, putting out a fire in the mouth, particularly if it's putting out 1 or 2 or 3 or 4 fires in the mouth, it can't do its other job.
Yeah, it'll be weak. Yeah, that's a very, very good explanation. Very good explanation. Is there anything else that you wanted to add?
Oh, gosh, I could just talk forever.
I know. We're going to have you back on at some point.
Yeah, yeah. You have to just stop me. Yeah, you just have to stop me, jump in, and just hey, let's do something else for a while. We've hit the really high points. I get excited about teaching all of this, and I have if it's okay if I just tell everybody, I have an open forum at dearholisticdentist.com. It's a blog, and you can ask questions, and then also on Facebook, dearholisticdentist.com, and I'll answer any questions, and love to be back on the show and answer your questions, and thank you for having me, and be glad to answer, anything else. Nothing else comes to mind right now. I am really excited about this Buteyko breathing thing I'm going to learn tomorrow night, so really excited about that.
Yeah, you can share that with us next time. And then there's some other questions I wanted to ask you. I actually wanted to get into asking questions around children, but we can do that next time you come on and touch on some questions that I didn't get to ask tonight. But thank you for answering the question about the root canals, and thank you for being on the show, Dr. Stevens.
Oh, listen, Darren, it's Lorie, and I'm just like everybody else, and I appreciate the opportunity to share this because I get excited about it, and I'll be glad to be back on anytime and answer any questions, and hopefully they'll the listeners will send you some specifics because I love to help people and love to also just give consultations because I'll tell you, dentistry is confusing, and even as a dentist, you really have to know the nuances of just like the root canal question. I mean, it's just a really complicated issue, and there's nothing black and white in dentistry, and so you just have to weigh all of the factors and that kind of thing. So, love to answer any more questions anytime. You just call me, and I'll love to be on the show. And so nice to talk to you, and hope everybody it could get through my southern accent. And I'm sorry, I'm one of those that stammers and stutters.
Hey, don't talk about that. I'm from South Carolina, so I know I have an accent.
Okay, there you go. That's it.
All right.
Well, listen, thanks, dear, and I really appreciate it.
All right, thank you, and I'll be in touch.
Okay, great. Good night.
All right, great show tonight. We got